Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on the UCP caucus ejecting Peter Guthrie. But first, drawing new doctors to the province.
We're quite disappointed to see a lack of interest in family medicine. There's a trust issue within Alberta.
The Alberta Medical Association sounding the alarm last month after unfilled residency positions. Every year, medical students rank location preferences and are matched with residency programs. And after the first round of applications, 31 spots were still open in Alberta. Now, the second and final round of matching is here. And joining us this evening, Dr. Pauwlina Cyca, President of the Professional Association of Resident Physicians of Alberta. Dr. Cyca, welcome to Alberta Primetime.
Thank you so much for the invitation to be here.
All right, so this is match day. How did medical residency positions in Alberta fare in the second round of matching results?
You know what? We are actually thrilled. The reason for that, of course, is because we've expanded our seats this year. The University of Calgary expanded the number of family medicine resident seats available for medical students to match in Alberta. We expanded both in the rural blocks and in the urban blocks. This expansion, of course, led to more seats being available, but also and more opportunity to attract new physicians to our province, but also to increase the number of physicians who are available in rural and remote Alberta. After the second round match, we have completely filled all of the rural seats, as well as the Department of National Defence seats as well. So given the fact that we've expanded the seats in Alberta, and there's a national trend of fewer medical students and graduates applying to family medicine as a whole, we actually proportionally matched more from a smaller pool. So overall, this is quite a good news story.
In that first round, there were 31 seats unfilled. This time it's what? It's maybe three? Two for the University of Calgary, one for the U of A?
This time there are 12 unmatched seats at the University of Calgary, and there are 4 unmatched in the Grand Prairie site. Again, putting this into context, last year there were 86 seats that were filled. This year there are 90 seats that are filled, and all of the rural seats are filled. And this is really what we're aiming for, is to increase the amount of access to medical care and to primary medical care to rural and remote Albertans, and to fill those spots in emergency rooms, in long-term care facilities, in emergency rooms, and so on. And so we've made great strides towards that. Of course, like anything and like any change, there does take some time for things to settle and for trends to be realized. Just like going to the gym, you wouldn't do 10 bicep curls and expect to be completely built right after that. So this is the first year of this expanded change, and we expect momentum here on out as well.
Okay, now we should maybe dig into this a little more. This is part of postgraduate training, right? It's necessary for licensing to practice medicine. So what kind of role do these new doctors play in completing this training?
I am really glad you asked. So part of the new role that residents fill is to carry the torch of mentorship. And so as a resident physician, of course, you need mentors, you need preceptors to teach you. And these physicians, of course, need to be practicing in the province to do this. And resident physicians also will precept junior learners and medical students. And so resident physicians play more than the healthcare role. They also play the role of the teacher. When resident physicians finish and transition to practice, and that's the stage that I'm currently in 2 short months, we will hopefully then take on learners of our own and continue to expand the program and continue to teach. That torch of mentorship is really critical in ensuring that our programs continue to flourish, as well as to continue to nurture a really strong learning environment for medical learners.
Okay, what makes our province a desirable destination? Where does Alberta register on the radar of medical students?
I am so happy you asked that. I'm originally not from Alberta. So there's several different things that I can tell you about Alberta practice and why it's beneficial. First and foremost, there has been an expansion of programs, not just seats, but actually recruitment and retention strategies to attract more medical learners to the province. The first being the Rural and Remote Scholarship and Bursary Program, which enables medical graduates who have matched to a family medicine residency access to funds to help them continue on with their training and alleviate the considerable debt that they end up accumulating and consuming throughout their medical training. Having access to this funding as a medical graduate, rather than waiting until they are transitioning to practice, is very unique. It's unique to Alberta, and it's incredibly beneficial. So that's the first thing. The second thing would be that our compensation for resident physicians is now up to market competition levels. But we also have additional benefits. Like, for example, our long-term disability payments is paid for us. So those premiums don't come out of our own pocket, for instance. And then third and final, this is actually a personal anecdote. So I have been a healthcare professional outside of medicine for over 15 years. I've practiced all over this country, all the way from the Maritime provinces to BC and the Yukon. And I can say without a doubt that Alberta is one of the most comprehensive places to practice healthcare. It is the easiest place to access patient information as a healthcare provider in order to provide that continuity and that understanding of the nuances of their unique therapeutic condition. And this doesn't exist elsewhere. It has been incredibly challenging in other jurisdictions to practice effectively. And Alberta, despite the challenges that most jurisdictions face, we continue to have these very strong and unifying, comprehensive ways to practice medicine.
You carry a very positive message. If we go back to the beginning of our discussion, we heard the clip of the AMA president a moment ago saying there is a trust issue in Alberta. What for you then is the impact of seeing family doctors already here, packing up and leaving?
You know what? This is having healthcare as a lever for government advocacy has been longstanding and will continue. This is a lever that we as organizations will, of course, pull in order to gain traction in certain areas. And that's not new, nor will it ever go away. These are circumstances. So hearing the political part of it can be a very challenging message for new graduates to hear. And I'm sure that that does have an impact on where people choose to practice, which is part of the reason that we want to get the message out that practicing medicine in Alberta is incredibly cost effective, it's incredibly comprehensive, it's very well supported, and there's an increased focus on that support. However, nonetheless, we need to also consider that public messaging that is reiterated over and over and over again. Having family doctors leave and go to other provinces has been alarming, especially for my cohort and the cohort that. This year, however, because of the new instituted programs that have been introduced, I can say from my cohort, there were 18 individuals that had originally intended on leaving the province and now have decided to stay. And when we were onboarding the new match residents, in fact, I called some of them today to welcome them to the program. These individuals all said that it was actually their first choice to come to Alberta. So even though we may be matching fewer, even though there may be that message in the media, the people who are coming are eager. And that's really important to have high quality residents.
Okay, well, we'll have to leave it there for time. Appreciate your time this evening, Dr. Cyca. Thank you.
Very nice to meet you. Thank you.
Dr. Pauwlina Cyca is president of the Professional Association of Resident Physicians of Alberta.